So I want to turn now to Naveen Thakur. He's the president-elect of the International Pediatric Association. He's joining us from India. Naveen, tell us about the IPA's approach to formula milk funding and about the challenges you're facing on this issue.
Yeah, so as IPA, our tagline, you can see working for every child, every age and everywhere. So we have always supported breast milk BMS code of WHO, and we have always worked with WHO to promote that. But before 2019, it depends also on interpretation. And I will be honest, as Franca, that before that, we have accepted from foundations, not companies, but foundation, because our interpretation was that. But as soon as this was pointed out, we immediately stopped, and IPA in 2020 IPA Executive Committee has unanimously agreed that IPA will not accept funding from any BMS industry or any entity associated with it, maybe foundation or maybe institute. And so as of now, we don't accept any funding from any BMS, any entity. Then, as I said, we are committed to work with WHO, and we have supported through our work plan with WHO as a non-state actor. We in 2020 to 22 we had this element in activities. Now in the going forward in 2023 to 25, we have already our strategic advisory group on nutrition has a plan of collaboration which propose technical approaches to address potential conflict of interest between healthcare professionals and manufacturers of food for infants and young children. But coming to the, as you said, the what challenges we face, as same as Franca. IPA is a umbrella organization of all pediatric societies, and only umbrella organization. There is no, everybody is under the leadership of IPA, 112 years old, from 160 countries. And while from lower middle income countries, there is, which, really have bear the brunt of the this violation of this code and these aggressive practices, there is a lot of support, and many of them, they feel this is more also not only policy but by law, but it is also by ethical and moral duty of IPA to support that, they feel. But we, as I said, we have member societies from everywhere and only one organization and running very successfully. So there are many other member society which have different views that we may not be affected by this marketing practices. And so there is not an agreement. And for us, we cannot force anybody, and we have to definitely listen to all member society. That's one thing. Second thing is, as Franca said, it's easy to it was always easy to get funding from either companies or their foundation in past, and it's very difficult to run a scientific meetings without funding. And definitely we may be better placed than midwives in getting other funding, but still it's a very limited space and getting more and more complicated. So these are the challenges which we face internally and externally. We cannot, we have to listen. There is a very strong feeling by that IPA should listen to the majority of member societies. And, there are large number of member society in Western world, with they feel we are not influenced and we should have choice. So it's a really a difficult situation for us. But as a IPA, we are very clear. We are not, we have a Congress in India. We are not accepting, we are not going to accept in 2005 in UK and also going forward, whether it is foundation, whether it is institute in any form. And we will discuss about how these, you are taken for a ride through different entities.
I want to know more about the relationship between the umbrella organizations and their member organizations. What are the opportunities for education through those umbrella educations? Lots of frontline health workers don't have the time to keep up with medical literature on the topic, and they may not realize its power. So how can umbrella organizations help?
Yeah, so I think, as Larry has shown that, that's the way forward. We have to create awareness, and that's really, we can do through our member societies, because we don't work directly through the pediatrician with the pediatrician, but we definitely can do more and more. And we have a definite plan for the next triennium, even with WHO and as a International Pediatric Association strategic plan to do that, to create more and more awareness in form of courses and orientation, guidance document. So there is definitely need. Can I also answer your legislation question if you don't mind?
Yeah, of course.
So I come from India, and I will say legislation definitely works. It gives you a framework, but still there will be role of these guidelines and member societies. Like we had this legislation, and that was then Indian Academy of Pediatrics. They my parent organization before I came to IPA, and still they endorse a very early, and they were working like Indian Academy, others were like working like watchdog. So there will always be role. If there is legislation, it makes us easy who believe in this as ethically and morally. It help us in doing that. And when I talk opposite, when we talk to the other societies which are not following, they say it's not land of the law. How anybody can force us? So you got my point that it definitely helps if we have legislation in place, and then society, pediatric professional association, and everyone work together. So legislation definitely helps. Thank you.
So I want to, Naveen, can I ask a bit about how we navigate companies flying under the radar, supplying education for specialist formula, for allergy workshops, particularly in dietetics? How do we, that seems to me a weak point that I've noticed a lot, is that particular formulas are recommended for particular medical problems. And so that is the foot in the door. And we see that even with some professional associations in the UK, that there is a blanket ban on relationships with breast milk substitute providers, although it can be discussed whether or not there could be a stand at a conference about a specialist formula.
Yeah, so thanks for bringing that up, because I also wanted to say that, because what we have in information document, and there is no mention of covert sponsorship through many front organizations or companies that are not actually involved in sell of these products, but this has become a very clever marketing strategy and norm in, at least I know, in Indian subcontinent, like X company marketing, as you said, maybe some product, and another nutrition company as front organization for a sponsorship and doing the promotion. So this is very important, and we should know these tactics, and we should be able to face that and counter that, because that's very, very important. So there, these companies, they find a way to reach out to you, and we have to be very careful. So there is no way that special formula or that formula or say nutrition supplement. So all this is same as we said, you change the name and become a foundation or institute. And so this is all, same. And then they market something, under that.